it is best that you know what to do to treat your child's nose bleeding. Nose bleeding is a common childhood occurrence. Colds, allergies, and dry air can lead to the lining of the nose to dry, crack, and itch. Also, children stick their fingers up their noses, and this can break the blood vessels in the nose and cause nose bleeding. Also, trauma to the face and nose can cause nose bleeding as well. In this video, we are going to talk about who are at risk for nose bleeding, what are the causes, when should you worry and call the doctor, and what are the ways to treat nose bleeding at home. Hi, I'm Dr. Kristine Alba Kiat. I'm a board-certified pediatrician, and my mission is to help moms and dads deal with child health problems to raise happy and healthy kids. Nose bleeding in children. What is a nosebleed? So nose bleeding is bleeding from the tissues of the nose, known as the nasal mucous membranes. The medical term for nose bleeding is epistaxis. In children, it usually happens in the front part of the nose, close to the nostrils, where there are tiny blood vessels. And when these tiny blood vessels break, nose bleeding occurs. It is a scary occurrence, but it is commonly found in children, and it is not usually a serious problem. It happens mostly in dry weather, and also commonly it happens during winter time. What happens is during dry weather inside the house or inside the building, the dry air causes the lining of the nose to dry, crack, and itch. Most children outgrow their nose bleeding into their teen years, so you need not worry. So what are the causes of nose bleeding? So dry climate, picking the nose, blowing the nose really hard, injury to the nose and face, and also colds, allergies, and objects inside the nose. Which children are at risk? So children are at risk if he or she lives in a dry climate, has colds or allergies, and picks his or her nose often. So the main symptom of nose bleeding is blood dripping from the nose. So bleeding from the nasal cavity in front of the nose usually comes from just one nostril, but bleeding from higher up the nasal cavity may come from two nostrils. It may be painless, but if your child has an injury, it might be painful, and if your child has a sore tissue inside the nose. Doctors diagnose nose bleeding by asking your child's health history and also asking if your child has any recent injury or accidents. Then your doctor will perform a physical examination. How to treat nose bleeding at home? First, you need to stay calm. Have the child sit and lean forward. Ask your child to breathe through his or her nose. Do not let your child lie down because if you do this, your child might swallow blood and this might make him vomit. Also, pinch the soft part of your child's nose with your thumb and index finger and do this for 10 minutes. Do not stop to look, because if you do so, you might have to start over. And then apply ice pack to the nose and cheeks. Do not put gauze or tissue inside your child's nose. Also, tell your child not to blow his nose. Once the bleeding has stopped, ask your child not to rub, not to pick his nose for 2 or 3 days. But if your child's bleeding has not stopped, it might be time to bring your child to a healthcare provider. Most nose bleeding episodes are just a nuisance, but you need to know what are the standard precautions when handling blood. First, wear gloves and wash your hands after handling your child's blood. Then sanitize the areas that come in contact with your child's blood. and also dispose of waste that is contaminated with blood using double plastic and secure them tightly. When should you worry and call the doctor? And what are the ways of preventing nosebleeding in children? But before we talk about that, do you have a newborn? Are you an expectant mom or dad? Do you want training in newborn care? Well, if you're interested, do check out my website with the link in this video. So when should you worry and call the doctor? Well, most nosebleeding episodes are not that serious, but you need to worry and call the doctor if the bleeding has not stopped, if the bleeding happens again, if there is injury to the head or to the face, if there is a large amount of blood, if your child feels faint, weak, or dizzy, or if your child has trouble breathing, where there is an object stuck in your child's nose, or if there are bleeding from other parts of the body as well. If your child has nosebleeding episodes often, there are ways to prevent it. First off, use a cool mist humidifier inside your child's room at night, and especially do this if there is dry air. Also, don't forget to clean the humidifier often. This is to prevent molds and germs from growing on it. Also, you can teach your child not to pick his or her nose often and not to blow the nose too hard. You may also apply petroleum jelly inside your child's nose several times a day, or you may also use saline drops. You can ask your doctor about it. If your child has allergies, you can ask your doctor what medications your child may take. And also, do not smoke inside the home or around your child. Hey, if you like this video, watch my other videos where I teach you about other child health problems.